So welcome everybody, and thank you for joining us today for our webinar, which is Dementia, Disability and Hope. And I'm delighted today that we are joined by Hare, who is the co-director for Innovations in Dementia. And Philly is going to talk to us all today, together with Nigel and Wendy, on this really important topic. So I will hand over to you, Philly, to get started. Thank you very much.
Thank you very much, and lovely to see you all here today. We can't actually see you, but I'm imagining you all watching the screen. So we're going to have a discussion between us about this vision of dementia, disability and hope. And we will leave a reasonable amount of time for your questions and comments at the end. I should just ask you not to ask us kind of individual or legal questions, because we're not lawyers and we're not advocates, so we're not able to reply to individual queries, but obviously anything else we'll have a bash at. So Wendy and Nigel, we need to introduce you first. Let's start with you, Wendy. Tell us a bit about yourself.
Yeah, I'm Wendy Mitchell from East Yorkshire. Yeah, living with dementia.
Living with dementia. And you live on your own, don't you, Wendy?
I live on my own. Yeah.
Happily on your own. Thank you very much, Wendy. And Nigel.
Hello, Philly. Proud dad to all the participants. My name is Nigel. I live in Swansea. Good afternoon to you all. I was diagnosed in 2012 with early onset. I'm chair of the Three Nations, involved in all sorts of things, and my particular speciality has been sort of human rights and equality laws. And that's where I lie. I think they're very important.
Thank you both very much. So I'm going to kick off just talking for a few minutes about dementia, disability and hope to get us into the discussion today. So dementia, disability and hope is a vision which is being created with and for people who are living with dementia. And it's been put together and articulated by a number of UK dementia organisations, including the Young Dementia Network, which obviously shares this vision. So what is the vision? Well, we believe that while no one chooses to have dementia, there are things that we can all do to make people's lives more hopeful. And we believe that it helps to look beyond the condition itself, the medical condition, and beyond its symptoms. Because social attitudes and ignorance, employment practices, and the physical environment can all be very disabling. And we want to help you, whether you're a person living with young onset dementia, or a family member or supporter or a professional. We want to help you to find solutions to these barriers which come from society and not necessarily from the condition itself. We don't think it's helpful to talk about dementia as an incurable, hopeless illness, or to refer to people as patients or sufferers, or even what we sometimes hear as shells of their former selves. We think it's far better to focus on the fact that life between the time of diagnosis and the end can still be meaningful. If you offer the right support and adjustments, people with young onset dementia can keep doing what they love doing for longer and even learn new things. And they can still contribute their skills, their life experience, their wisdom, and the vital roles they play in society, whether as a partner or a parent or a family member or a friend or an employee or a volunteer. These are all the things that they can continue to bring to society. And we also believe, very importantly, that this approach brings very significant benefits to their families and supporters as well. So that's hopefully the vision in a bit of a nutshell. There's a lot more to it. It's based on human rights. It's based on dementia being legally classed as a disability. And I'm going to hand over now to Nigel, who's going to tell us a bit about the importance of human rights and disability rights to people with young onset dementia. Nigel.
Thank you, Philly. This is going to be a whistle-stop tour, really. So I don't want anybody to sit there with their eyes rolled in the back of their head saying they're going to have to take in a lot of information at the moment. I can put some links in the chat as we go along where you get more information. But if you think of your own lives prior to dementia, or the lives of the loved ones before dementia occurred, or indeed my life, it was so differently viewed by other people than before, when we were sort of, in inverted commas, normal. Although I suppose it's fair to say most people say I've never been normal, but our human rights are there simply because we're human beings, and we have an inherent right to dignity, respect, and value. And the Human Rights Act of 1998, and the one that was put into public royal assent in 2000, that gives you 40 minimum standards by which you should be treated by governments and agencies. And these standards more or less tell us how we should be treated. Our human rights are protected and guaranteed in various key ways. Firstly, it places a legal duty on public officials, including health and social care, to uphold these standards by respecting our human rights in everything that they do. This is sometimes lost. And if you don't enact your human rights, they disappear. And when they disappear, they disappear. They shouldn't be affected by age, sex, gender, or frailty. They're still there, no matter where you are in your dementia journey in particular. All legislation and social care should be done within the framework of human rights values, particularly Articles 5 and 8, which deal with liberty and family life. And it starts with diagnosis, really. I mean, if you suddenly realize that people have a case conference about you, you're not there, you know, that's a huge infraction. The one that always irritates me is the fact that you find after diagnosis you're in the care of a mental health team and there's no obvious mental health issues. Human rights leads us to believe that everybody should be treated with dignity and that these rights are inherent. If we don't use them, then they become redundant, and if they become redundant, they're lost. I'll put some links in the chat box afterwards, which give you more information, will give you ideas of the schedule and some training documents you can pick up for free, which will give you a better. Now, the importance of human rights allows practitioners to think outside the box, and I've actually seen it work when they develop a service based on a human rights base. A light bulb moment goes off. Think, oh yeah, you know, we are doing that. We shouldn't be doing that. Human rights also leads you to believe, and sort of the pathway that is straight in, that is dementia just a medical issue when it isn't. The Equality Act defines what dementia is. It's a lifelong condition which affects the activities of daily living. If you have that, then you're disabled in the real terms. And that's really important for young onset in particular, because when I was diagnosed, it was naturally assumed I couldn't work. But under the Equalities Act, employers are burdened with making reasonable adjustments to take in your disability. But obviously, if you've got dementia, it's unlikely you'd be able to carry on work as an air traffic controller. But you know, you would. There is other things you could do. I mean, and the particular job I was in at the time, it would have been impossible to do with dementia. But there was other things I could have done probably. But I got a funny feeling that employers and the like look at it because when they tell the person with dementia they can no longer work, it just follows on with the stuff they told at diagnosis, this disabling diagnosis, which is an infraction of human rights. Nobody has the right to tell you your life is over. Nobody, unless there's a condition which is going to have an effect on the lifespan. But you can't tell somebody with a condition which nobody can track, which nobody can perceive, that they should give everything up and have this disabling view of what they are. Although we do become disabled. Now, there's strength in that word disability, isn't there? When you think about it, if you're seen as a patient, it's frailty and it's going downhill and it's losing abilities and it's diminishing. Whereas you see with the word disability reminds me of the words that spurs me to think of things like activism, standing up for your rights, getting better, adjusting, and still making your mark. And life is very, very much not over. Dementia, although not mentioned under the Equalities Act as a disability, is because autism is mentioned, but that's always recognised as a disability. The problem comes, particularly for young onset of working age, is when they have to prove their disability to things like a PIP tribunal. It's then because they don't understand legislation. Now, I've got a bit of experience in this. I've represented 130 people at tribunal, and I've not lost one. But it don't mean I'm good. It just means the system doesn't work. And the figures for the system are quite clear. 68% of referrals to appeal get upheld. So 2/3 of people, or just on 2/3 of people, who are initially told they haven't got a disabling condition at the assessment stage, people's minds change. Now that has a terrible effect on people, because no disability, irrespective of what it is, should be a gateway to poverty. Unfortunately, it is. And this is why we need to use the Equalities Act. We need to use the Human Rights Act to bring forward these very, very big challenges that people find.
Thank you. Thank you, Nigel. Sorry, I didn't mean to cut you off there, but...
No. I'll talk all day about this. Sometimes his eyes glaze over.
No, not at all. That was a really helpful context. And I think hopefully you've shown the importance of thinking about human rights and disability rights in the context of dementia, and that's something that we don't talk about enough, perhaps. And you've also, I think, shown very clearly how actually using the label disability or thinking about the context of disability is not a depressing thing. It's actually can be a really positive and hopeful thing, because it gives people understand then that things can be changed, actually. And that's where we get on to reasonable adjustments, isn't it? And the requirement to actually change the environment or even change attitudes, as long as that is possible and reasonable. So thank you for that context. I'm going to come now to you in a minute, Wendy, and think about some of the practical implications of what Nigel's been saying. And I suppose the question we're asking now is, how can the promotion of reasonable adjustments be used in making life easier and more accessible for you? And I think you had a negative example and a positive example. Your negative example was about your experience in work before you even got diagnosed or around it.
Yep. I was diagnosed 7 years ago, and I worked in the NHS, so I naively thought that I was in the right place to get support. But they may have been wonderful at looking after patients with dementia in hospital, in that setting, but they were very inexperienced and at a loss as to what to do with an employee who'd been diagnosed with dementia. And my manager, his first words he said to me were, "How long have you got?" So I knew then immediately that I was going to have an uphill battle, because I wasn't ready to retire. I hadn't got used to the idea of having dementia. So to suddenly have to give up work, that would have been a huge financial loss, because I was only 58, but also a huge emotional loss. And from work's point of view, they simply sent me to Occy Health, who then started filling in the retirement due to ill health documents. But again, I said, I'm not ready to retire. And what happened was I came up with a solution of reasonable adjustments. I came up with a plan to enable me to stay at work. And that was the wrong way round. We should have had a conversation which should have started by them saying, well, how can we help you continue to be at work? And then the conversation would have felt less threatening, less imminent that they wanted me on. But they agreed to my reasonable adjustments that I came up with, probably because they knew they had to come up with reasonable adjustments and they couldn't think of what to do themselves. So they agreed to mine. But it was a huge uphill battle to convince people that I still had a lot of knowledge to give to others, for the team to continue working.
And it was an uphill battle that you just didn't need at that time, because you were coming to terms with so many other things.
That's right. It was it's just the one thing you need when you've just been diagnosed is support of work around you, support of people believing that you still had something to give.
Yes.
That's the best thing you can give to someone when they're newly diagnosed, is by telling them they've still got a life to give.
Thanks, Wendy. That's a great example of reasonable adjustments which were eventually made, but not made soon enough, really.
Made on my terms, not
made on your terms. Yes.
Yeah.
And I think you had a more positive example when you visited an audiologist recently.
Yeah, I did. For those listening and watching, I'm not sure if you're aware that many people with dementia can have hyperacusis, which is simply a sensitivity to noise, just like children with autism, but works in a different way. And there's not a lot of audiologists who instantly recognize that fact at the moment. But my audiologist, when she first met me, she gave me a 2-hour appointment. Now, who on earth has a 2-hour appointment in the NHS? But she knew, she understood that I had dementia, so I would need more time. But more importantly, she needed more time to understand the complexity of dementia and sensitivity to sound. And she actually also condensed 6 visits into that one 2-hour appointment. So I wouldn't have to keep going backwards and forwards and starting all over again. because that would have not made any sense to me. I would have forgotten the last appointment the minute I went to the second. So for her, she gave this 2-hour appointment. She even took me outside the consulting room, outside in the fresh air where the noise was, to physically see for herself the effect noise had on my ears, which was, to me, unheard of. I never experienced anyone going that extra mile. But she immediately understood what was happening. She could see me cower when a siren went past, when a motorbike went past. And so she adjusted, gave me hearing aids, which were programmed to take out that tone of noise that physically hurts my ears. But not only that, she then gave me her email address because she knew I couldn't use the phone. And so that any time I needed a follow-up or something needed adjusting, I could just email and get the appointment. So it saved the NHS in the long run, because 6 appointments wouldn't be enough, because I'd be rabbiting on about the same thing each time and we'd probably get nowhere. But that 2 hours, she solved the issue, and I went away completely, my outside life completely changed for the better. So to me, that is reasonable adjustment.
Thanks very much, Wendy. That's a great example, and well done to that audiologist, whoever they are. Maybe they're watching today. But I think it also, you know, we should stress that making reasonable adjustments isn't about giving people who demand it special treatment. It's simply about bringing people up to a level playing field with anybody else, so that you can achieve the same thing, or so that they can achieve the same thing. Right, we'll give you a bit of a rest, Wendy, for a minute, and over to you now, Nigel. And I think you had a couple of examples, maybe one negative and one positive, of reasonable adjustments or not in your own life with dementia.
The positive ones in my life have been people who are close to me who recognize my dementia as just being what it is, a disabling condition. And my GP practices are very good at that. My GP practice is very good at that, although I tend to stay away from them as much as I can, because you don't overburden things in today's age. And I've been able to enact positive discrimination through being a member of a policy group in particular, by using the Equalities Act to point out that by just tweaking the system slightly with positive discrimination, you can change the way a person's life is. The sad fact is that our dementia comes with us wherever we go. You know, we can't leave it at the doorstep, so it's a constant factor in our lives. And wherever we go, you can't cure our dementia, but you can make our life a lot better by making reasonable adjustments and working with us within the premise of a disability framework as opposed to a medical framework. My negative aspect, I think, I suppose, was when I was threatened with section in my own home. And this goes back to my initial thing of when you're diagnosed, you're put under the care of a community mental health team. Now, I've heard all the arguments, you know, and they're mostly administrative ones, you know, well, because psychiatrists have the access to all the services and what have you. But in practical terms, to the individual, it opens you up to things which are far more, you know, just the label of being under a community mental health team, for instance, is very difficult. But if you want to seek further employment, if you're still a working age, you know, I got to have Wednesdays off because I see my psychiatrist, you know, it kind of works against you in that way. But of course, it also opens you up to things like the Mental Health Act, you know, and that terrible Mental Capacity Act, which is nonsense. You know, I'm an IMCA, which is an independent mental capacity assessor, and more often than not, it's a very pejorative thing because we work off a deficit agenda, don't we?
Mm.
We look at what people can't do. I was threatened with section in my own home. And luckily I had a copy of that booklet we put together, Dementia and My Human Rights, and I told the guy to go look at it. I was in that position to do it, and he kind of backed off a little bit, the registrar, when he saw it. And then the policeman took over, and I said, you can't put a person in a place of safety in their own home. They're already in a place of safety. Now I know.
Sorry, go on.
Go on.
I was going to say, so that's a great example of how, because a lot of us are a bit reticent about talking about our rights, aren't we? It feels a bit maybe aggressive sometimes, but actually the fact that you mentioned there quite assertively that you have rights seems to have made a difference to the outcome.
Yes, it does, because, you know, the law's the law. And, you know, the Human Rights Act, irrespective of what the Daily Mail says, it's not a terrorist charter of the rights for prisoners to have, you know, to have artificial insemination so they can have a family. I mean, that's just the odd stuff that comes up. I mean, it protects us all against, for instance, you know, as a woman, you're now entitled to name your accuser in court. That wouldn't have happened prior to this, because you're accused, you know, whoever you're accusing of assaulting or was able to have a shield of anonymity at his choice. Now he can't. That comes from the, but there people don't question that. The right to choose your own care home really is you know, it's Article 8. It's there. It's implicit. And a better understanding and a better understanding of human rights and the way it works does give us that integrity, doesn't it? Which leads us on to the disabilities issue. And I know a lot of people don't like being labelled as disabled because they got one label.
I'm going to ask you that, because a lot of people would say, gosh, I've already got the label of dementia. Why on earth would I want another label of being a disabled person? What would you say to that, Nigel?
Well, I get it. I understand it. But I don't care what you call yourself. You call yourself a purple people eater, as far as I'm concerned. But don't flush away your enumerated rights under the Equalities Act. Don't do it, because it's what stops people doing things to you. Okay. You know, and we all want self-determination, irrespective of where we are. Every dementia journey has a beginning, a middle, and an end. Thankfully, human rights doesn't take any notice of that.
Yeah.
Doesn't matter where you are in your journey, you still have inherent human rights. So I don't, you know, I get I get the fact that people don't want a second label. I do understand it. But I also say that, you know, call yourself what you want. You know, you don't have to refer to yourself as disabled.
So it's a means to an end, is it? Would you say it's a
very much so, very much so. Yeah. And, you know, just take advantages of the way that understanding, or your advocates understanding the Equalities Act, you can challenge certain things that you may find disagreeable. You know, like choice of a care home, like how you live, and like where you want to be cared for, and the standard of the care that you're going to be given, and the quantity of the care you're going to be given.
Thank you, Nigel. Thank you. Okay, I'm going to come back to you now, Wendy, and talk about people at maybe the more advanced stages of dementia. I mean, Nigel just said that human rights, it doesn't matter whether you're at the beginning or the middle or the end of your dementia journey, if you want to use that phrase. But some people might say, is all this right stuff really relevant at all to people at a very advanced stage of dementia? What would you say to that?
Well, I would say, if you think it's not relevant, then you're not seeing them as a human being. Because from cradle to grave, we all have human rights. It doesn't matter what disability, what stage of dementia you're at. You're still a human being with human rights, and it's of no consequence whatsoever what stage of dementia you're at, whether you can speak or not. You're a human being and need to be seen as that.
It's a great answer, Wendy. I mean, can either of you think of an example of somebody who may be at the very end of their life, of how their rights can be made real? How they're
good advocacy, Philly. Good advocacy. I love the Canadian system where every person, every elder person has, if they want, an independent advocate. And not just for people with dementia, for people with autism, for people with severe mental health issues. When the going gets tough, somebody's there to sort of make sure that you're treated with. You see, it's quite easy. You go to any medical ward in the country today, and I could point out 4 or 5 infractions under the Human Rights Act. And these are not deliberate. These are because of the way hospitals are task oriented or whatever it is. But nevertheless, they're there. But in many cases, things get extreme before these issues are brought before courts and the like. But as Wendy says, it's cradle to grave stuff. A one-day-old baby has the same human rights as an 85-year-old woman in a care home, or man in a care home, exactly the same. All the rights to life, the rights not to be treated, it's all there, and we should be using it.
Thank you, Nigel. Wendy?
I can think of more recently during COVID and everything, 2 examples. One of this isn't to do with COVID. One example is a care home wanting a patient to move, wanting a resident to move because they've become challenging, they've become violent. This is that person's home, and actually they've become challenging, in their words, because of an unmet need. It's not the person's fault that they're unhappy, unsettled. They have to see that there's a reason for people to behave like that. But also, I'm thinking of during COVID, when some horrific examples I could quote of people in care homes being left in their room and not having had a visitor for 18 months. And the reason they stay in their room is because the effort it would take to get them down to a visiting part of the care home to see their loved one was too traumatic, that the care home insisted they stay in their room, but the care home said it was because they wanted to stay in their room. So it's that person has a right to live a life.
Yeah.
And living a life isn't living in 4 walls. That's living in prison. But even prisoners have human rights. So yeah, I hope I made sense then.
Definitely made sense. And it's not just recent, but it's still a very current issue, isn't it?
Yes,
where rights are being ignored. Yeah. Thank you. Okay, so I'm just thinking about our audience today, and I'm sure that there are people in the audience who are family members, supporters, unpaid carers, however they like to, whatever terminology they like to use. And to play devil's advocate, I guess some of them might be thinking, Yeah, it's all very well talking about the rights of people with dementia, but what's this approach really got for us? You know, how is it going to help us in our caring situations? Have either of you got any thoughts about that? Maybe Nigel first, to give Wendy a rest.
Well, because it gives you a framework to ensure that your loved ones get the best possible care. You only got to look at the pandemic, where hospitals were refusing to take people with dementia from care homes unless they had a DNR. Now, come on.
Do not resuscitate, DNR.
Yeah, I mean, how many ways is that wrong? But you can fight these kind of decisions using the current legislation. The problem is that people get exhausted by it, and I do understand why people roll their eyes and say the things that you said, because it's very difficult to come to terms with a very complex. But there are people to help you if you wish. The people to help you navigate these things. They are difficult because it's legislation and it's bothersome, it don't go in straight lines sometimes. But I would say that you have to work on the framework of that, irrespective of where your loved one is, he's still a person. We're all with all the inherent rights and responsibilities and civic duties of a citizen, and these don't diminish because somebody decides at the stroke of a pen, well, you're less of a person now because you've got a particular condition. That's the way I felt on diagnosis. I was being viewed as a slow drip of people telling me that I wasn't, I shouldn't worry about this and I should worry about that. And I worry about everything because we all worry about everything.
Yeah.
Okay. So there are groups who are out to you, but use it as a framework. Don't use it as something to be afraid of. There are easy read versions. I put some stuff put some links in the chat box that people who understand it, in plain English as opposed to highfalutin legalese.
Thank you.
Yeah.
What would you say to family members, Wendy?
I would say don't use us as objects to be fought over. Where think of us as the human being we are, and that these rights are your confidence to challenge when something doesn't feel comfortable, when something doesn't feel right. If something doesn't feel right or look right, it usually isn't. And so, just see us as a human being who you're protecting or speaking for. And yes, it is a maze of laws, but as Nigel said, there are people that can help. There are easy read places to look. So have the confidence to challenge.
Thank you. And I think, I'd add just an extra point that obviously, if the life of the person living with dementia can be made easier by reasonable adjustments, that almost always makes the life of the family easier as well. So that's what's in it for families, but also that carers, the family members, also have associated rights under the Equality Act. So, they can actually, use their rights, express their rights to things like having a break, having time for family life, whatever it is that's putting pressure on their specific situation.
Yeah, rights aren't there to be frightened of. They're there to help you. They're there as a means to an end.
Thank you. And yes, it's you don't need to know the names of all the articles like Nigel does. You simply have to say, I have a right under the Equality Act, and people will shift. People will jump.
it's not simple, because it takes a lot of courage to challenge an organization.
It does.
But I'm just thinking of one thing which should be universal. One of the huge fears of carers is outpatients appointments, because they disrupt a person's routine.
Yeah.
They're in a very, I mean, why on earth doesn't every health board and every health authority and every teaching hospital or whatever it is, just make sure that people with dementia go to the top of the queue? Because it's usually for something like a diabetic clinic or hearing, or go to the top of the queue. So you're in, you're out. The distress period is limited, and what a help that would be to the carers and to the person with dementia. That's just one simple example of using the anti-discrimination laws under the Equalities Act and the allowance of positive discrimination under the Equalities Act to work for people. And just think outside the box. We tried to do it in Wales, and what we said, the doctors didn't like it because they'd like to prioritise the cases. Well, come on. Who works for who? Do we pay them? Do they pay us? I don't think so. And it's about looking. You see, it's about common sense issues in a highfalutin world. I mean, people get paid a lot of money for explaining to you the Human Rights Act. But it's a very simple act. It's all about, as Wendy says, if it don't look right, if it don't smell right, if it walks like a duck, if it sounds like a duck, it's a duck. And don't go into the complications of this schedule and that schedule and this act and this protocol and that protocol. I mean, every nursing home should. When you go into a nursing home, the one thing I don't want to happen to me is to have my private belongings locked away from me, taken off me. But the chances are that's going to happen. Now, that's illegal under Article 1, Protocol 1. Now, I know that, and I'll mention it when I go in. Because it's their responsibility to make sure, because they now take responsibility for my care, it's their responsibility to make sure this happens. And we allow people to get away with so much. That's a long way.
I want to come and watch when you go in a care home, Nigel.
We'll all come and watch.
Well, they're going to have to pay for the privilege of my company, I can tell you now.
We're going to wind up our discussion in a minute to leave time for questions and answers. But can I urge you all to please type in your questions and answers, or your challenges. You might not agree what we're saying. We would love those challenges, even if you're sort of playing devil's advocate, like I have been a bit. It's a very useful way of bringing out the points that we want to make. So please do that. I've got one last sort of devil's advocate question to either of you, and that is to say, this is all very well. This approach we've been talking about, and this greater focus on reasonable adjustments. But don't we really need to focus on a cure or a more effective treatment for dementia over everything else? Isn't that what's really important? Wendy, you're shaking your head.
Not for those living with dementia now. They've been trying for a cure for I don't know how long. In my mind, there's a 900,000 or whatever the number is now, human beings in this country who need human rights now. We don't. If a cure came, we wouldn't be affected. So we have to think of the social care of the people that currently exist, and working in the background for the elusive cure. that should be happening with the rich pharma companies.
Thanks, Wendy. Nigel, did you want to respond to that one?
Well, yes. I mean, if your car broke down, how would you feel if the mechanic said, "We're going to check this car away, you haven't got one, and so we develop a new one"? You'd be happy with that, would you? By the same token, you've got a population of people affected with dementia who know that a cure won't help them, but who support research because they know that a cure in the long term is in everyone's interest. However, we have massive issues, facing people, and the dementia community, which we haven't really tapped yet. Social care, for instance. Who cares for the carers? We're all living longer in various degrees of frailty, and nobody seems to have the answer. What have we had? 12 green papers, 2 white papers on social care, and every government has kicked it down the road. So, we need the human rights framework to look after people already diagnosed, and we also need the human rights framework where people have a right to things like a good state of health, and that includes preventative measures for illnesses which they already know and disabling conditions which they already know is there. So I mean, we can't have a two-tier system, can we? I mean,
thanks.
We need research, but we also need.
Thanks, Nigel.
Yeah.
Wendy, were you going to say something?
I was just going to say, don't use the elusive cure finding as a reason to diminish the huge problem we have in social care at the moment.
Thank you. Yeah, I think what's been made very clear from listening to you guys is that actually many of the reasonable adjustments that can be made are actually very easy, very cheap, comparatively cheap, common sense things that can overcome all the barriers all the additional barriers that you experience from the way society is designed and responds. You will still have to cope with the clinical condition. You will still have to cope with the symptoms as they come along and all the things that make your lives difficult from dementia. But if we actually take this approach, what you won't have to cope with is all the ridiculous extra barriers that stop you doing what you still can do. I think exactly. Made that very clear. Thank you. So we've got just over 10 minutes for questions and answers. I'm just going to look in my chat and see if there are some there. There's a quick question from Rebecca for you, Wendy. What was your job in the NHS?
Yeah. I used to train sisters and matrons how to roster their staff. So I was the most unpopular person on the planet when rotors came out.
So you're a very organised person, and I think that has been a real benefit to you, hasn't it, since you've had dementia?
It's carried me through my dementia world.
Thank you. And we've got a question from Elaine White. Elaine's saying, do you feel that more is concentrated on research and cure than maybe more effort is concentrated on research and cure rather than on the highly important changes that you've spoken about today? Nigel?
Well, I think it's a balancing act, isn't it? I mean, and I think to stop dementia occurring in anybody in the future is highly important. But also we need to look at where we are with the same approach that was done with HIV in the 80s. The same approach, wasn't it? They concentrated on a cure. They found a cure eventually, but at the same time they decided to make HIV a health driver, and that helped anybody that either by accident or consequence became the HIV thing. And I think the same thing should be happening with dementia. you know, that we should concentrate on research, because it is important. It's the hand of hope, really. And secondly, we should be looking at the provisions that are provided across the board nationally, and all of these little pockets of excellence, which are great. But you know, say you know, and start using a human rights, a rights-based approach when we set up strategic services and stuff like that. Are we providing what people want, or are we providing what we think people want?
Thanks, Nigel. And Wendy.
Yeah, so social and technical research is equally important as clinical research. I don't mean that word, but I can't think of the word. And it shouldn't be seen as second best, which it always was. Social research was also always seen as second best. And actually, for us now, that should be a priority. So as Nigel said, there's a balance. We need to get the balance right.
Thank you. Please keep typing in your questions. We'd love a few more questions. I'm just looking at the chat now. Rebecca, you're doing a sterling job. Loads of stuff in. I've just spotted something from Elizabeth Williams, who says, my brother was told that in order to see his son, he needs to pay £3,000 for a neuropsychology assessment because his estranged wife questioned his capacity for his own gain, despite his GP and neurologist saying he does have capacity. I feel the judge and the solicitors have just heard the word dementia, and rather than speak to my brother, they have just ordered assessments. It's sad. So yeah, there is that thing about still such a lack of understanding, isn't there, that people, whether they're professional or not, maybe hear that word dementia and they make assumptions rather than thinking about that person as a full human with rights. Wendy?
Yeah, I had that very issue when I broke my wrist at Christmas.
Oh, yes.
The first thing the consultant said when me and my daughter walked in the room to discuss the operation was, well, on paper, I wouldn't operate because you have dementia. Why do you need a left hand? And
sorry, I just laughed.
I know, I was in a state of shock and couldn't actually think of any words, polite words to say to him. But luckily my daughter spoke and told him why I needed my left hand. And then I came to my senses and also mentioned why I might need my left hand just as much as he does. But it's making that assumption that, well, why? Because I have dementia, should I not need a left hand? And I've heard of so many other cases where people with dementia are sidelined for operations because of their dementia. And that is just ludicrous and must be against all human rights possible.
Yes. Capacity is this stinging issue, isn't it? I mean, judges don't understand it, lawyers don't understand it. Capacity, the legal definition of capacity, well, there isn't one. They can tell you what capacity is not, but they can't tell you what capacity is. Capacity is not bizarre behavior. Lack of capacity is not engaging in risky behaviors. It just isn't. Yeah. Capacity is always assumed to be there unless proven otherwise. So the judge that ordered, I'm not saying he's wrong, I'm just saying he probably doesn't understand what the capacity laws are. And you know, I mean, capacity is there unless it's proven otherwise. It's assumed, and it's not necessarily acting strange. I mean, I support Cardiff City Football Club. That could be saying, well, capacity.
We couldn't possibly comment.
Yeah. So you know, that's the issue. It's one of these areas that people go to when they don't want you to do things.
Yeah. Okay.
Mm.
I mean, just finally, I suppose, just wanted to mention one other area where this is highly relevant to people with young onset dementia is about driving. And often the assumption is made that as soon as you get the diagnosis of dementia, you shouldn't be driving for one more day. And that, again, you know, that's wrong. And it has to be by individual assessment, doesn't it?
Well, it's a human rights issue.
Yeah.
It's a human rights issue. It's you know, it can be, you know, you could say, well, it contravenes Article 8 because it means I can't have a family life because I can't go to see people. It doesn't do me any good because we all know dementia is an isolating condition anyway. But if you further isolate it, everybody is at, you know, you have to be proven not to be safe. How can, since when have GPs become driving instructors or driving assessors? I mean, you know, there's this stuff of the, I see Rebecca's just put a link in for supporting. We had a webinar on it with Three Nations, and we had a guy from the DVLA come up, but he couldn't tell us why they do that. He said, well, it's assumed that once you know, you more or less trying to say nicer terms, well, you've all lost your marbles, so where could you drive? You know, I mean, that was the view, you know, which so many decisions again are challenged and are won at appeal. You know, there are people I know who've had their license taken off and then given back. The least they can do is give you a yearly license.
We've just got Josephine Gordon, who's just put in the chat, that happened to my husband. We were told by the psychiatrist he couldn't drive. Actually, we found out 10 months later that he could, but he had to tell the DVLA. So now he's lost the capacity, I think. And that's a very sad example of people not thinking about human rights and not thinking about the barriers and not dismantling the barriers that society puts up for people who are diagnosed with dementia.
There's comments in the chat box about being fined £1,000 if you don't tell people, the DVLA, you got dementia. But you see, you can understand why people don't.
Yeah. So I think we're coming to the end, and want to thank you both very much for giving us some real insight into this whole vision of dementia, disability and hope. And I'll hand over to Catherine.
Thank you very much. That was absolutely fabulous listening to the three of you talk there. And thank you to Wendy and to Nigel for sharing your own experiences. And I think it really helps people to listen to the experiences that you have and the advice that you can give to people. And thank you, Philly, for hosting and being our question master today. Thank you very much for that. And thank you everyone for attending and for your chat and Q&A. We appreciate everyone's support today. Our next webinar next month on the 27th of April follows on from this one, and it's called Employability. And we are going to be talking about working after a diagnosis of young onset, working in a current role or working in the voluntary sector, and the positive experiences some people have had. So that we will be joined with by Louise Ritchie, who is from the University in Scotland, who will be hosting that webinar for us. So we hope you can join us. So thank you everyone for attending today, and that concludes our webinar. Thank you very much.
Yeah. Thank you.
Thank you. Bye bye everyone. Thank you.